Yeah, dude, I wanted to get into a little bit of like the root cause of um, soft tissue injuries, like musculoskeletal injuries and stuff. And so like, as you see patients day in, day out, you don't want to just treat the symptom, right? Like as a doctor, you don't want people to just be coming back all the time. Eventually you want them to be, have the freedom to go out and function the way they want
Sure.
to, right? And so um, you want to do anything you can to help them identify what the root cause of why they had to come see you or why they needed help from some other medical professional. So how have you seen that in your practice? Like what's the root cause of some of the stuff that you see in your practice?
Yeah, my conversation with, let's say a new patient comes in, they say, "Doc, I have elbow pain." My first thing that I tell them is functionally, we need to figure out why, right? What is causing the pain? What's the source of the pain? Because that person wants pain relief and I want it for them. But why is their elbow beat up? "Doc, I have tendonitis." "Why?" And it's just kind of crickets. It's like, do you know why? Like, is it a bad movement pattern? Is it lack of recovery? Is it so? I think it's important. It's an important topic, and it's something that we have to take from a clinical standpoint. It's something we have to take a step back at and look closely into for the athlete. My personal opinion for why most soft tissue injuries occur, assuming you didn't get hit by a bus or you didn't get a helmet to the shoulder playing football on a
Hmm.
Friday night, the top two things, in my opinion, are repetition and lack of recovery. And that second piece is going to make some people cringe, especially the strength coaches are like, "I need them 6 days a week." It's like, well, I'm okay with that. But if the athlete is repetitively going in and doing the same movement over and over and over again, the repetitive injury cycle comes into play. And really what that is event, right? So throwing a baseball 100 times in a day, you get a little bit of inflammation, get a little bit of scar tissue laid down, resolution, next day, next day, next day. And we see this gradual just accumulation to the point where it's the straw that breaks the camel's back. And we don't think, it's easy to look at throwing a baseball as a repetitious injury. We don't look at how you and I are sitting right now and multiply that by 8 hours or 12 hours or 16 hours a day, depending on our occupations, and say, oh, that's going to beat up the same muscles, the same joints in the same manner every single day. And
That's
so I think
fascinating.
you have to take a step back and look at where in my daily life am I getting repetitive strain or repetitive micro trauma on the joint tissue and muscle tissue in my body. And that can be from the gym, it can be from the playing field or playing court, it can be from your couch. And so beyond that, if you're not giving the body adequate time to repair that, if you're not doing self-maintenance in terms of foam rolling or stretching or whatever the athlete is doing, if that isn't balanced, you can only withdraw money out of an account so long before it's zeroed or it's negative. And every tissue in the body has a limitation and it will show up. And it doesn't matter if you're an Olympic athlete or if your grandma, 75 years old, gardening every day in the summer. It's like, it's going to show up. And that's just the way it is. So I think those would be the top two reasons that I see, especially soft tissue injuries in the body.
That's fascinating. I definitely see the repetition a lot within my coaching because like um, I focus a lot on movement patterns
Yeah.
within
Yeah.
strength conditioning and CrossFit and coaching and everything. Because like if you repeat a faulty movement pattern enough times, guaranteed you will have some sort of pain or soft tissue injury that's going to show up, right? Like, but if you work on the movement patterns first and then regulate the loads you put on that, then you're going to have a lot less troubles
Yeah.
down the road,
Yeah.
right?
I'm a big car guy, and where I practice, there's a blend of rural people coming in. So I try and make my examples of, hey, how do you explain what's going on to this patient in terms they understand? I'm like, if you take your tires and you drive and you rotate them regularly, they're going to last a long time. Tires are still going to wear out, but they're going to last a long time. So it's like if your movement patterns are good, if your recovery is good, if your diet's good, if you're getting treatment, massage, chiropractic work, whatever, the tires are going to last a long time before there's an issue. If you're rotating 3 tires and ignoring one, that tire is going to wear out faster than the other three. If
Mm.
you're not rotating any of them, they're all going to wear out pretty fast. And so the body's a machine, right? It's affected by the environment that we put it into. And I think it's awesome that you, from my perspective, it's awesome that you, with the clients that you see, appreciate that and understand that, because a good sports medicine doc, a good trainer, a good strength coach should be able to grasp that and implement that for the athletes that they're working with. You know, the
Yeah.
car, so to speak, the athlete doesn't think for itself. The driver
Right.
does, right? And that's kind of a funny way to think of it, but I think that's a huge thing, a huge benefit that the athletes that you work with receive.
Yeah. Yeah. And it's kind of interesting, like with that car analogy, like if you're burning up one tire over the other three, or you're burning up three tires over one, like you may not notice it at first, but eventually something's going to blow out, you know?
Yeah.
And so kind of similar, like in like a training setting, like this is super, super common. This is something that I try super hard to constantly repeat in my coaching. Is I preach this like almost every day of like, I want you to care about how you move more than how much you move.
Yeah.
Like move well first, then move often, or load that movement. Because what I find is like people will prioritize performance first, and then they care about how they move. And so you see people compromising their technique or something in order to get an extra rep or beat the
Yeah.
person next to them, you know? And that ego is something that comes back to bite us. I mean, like you and I probably had several ego injuries, you know?
Oh, we probably got more coming too, I'm
Oh
sure.
yeah. I mean, I remember specifically, I came to visit your gym in your home in your town there, and it was hilarious. Like we're doing snatch, right? I'm like, I can snatch way more than Mitch. I'm totally gonna embarrass him today. And I jumped up a little bit too heavy, made too much of a increase in weight from set to set, and I almost dropped the weight on my neck. You know, it's like, whoops.
Yeah.
It was
Yeah.
like the most embarrassing moment. And your coach still makes fun of me because you're like, oh, you're just super qualified strength coach. You dropped the bar on your neck. You know, like I was lucky to come out okay there. But like, just kind of goes to say, like, prioritizing how you move is going to help save you a lot of injuries down the road. It's going to
Yeah.
address that root cause much sooner. And so like a lot of times what I end up having to do with athletes is like, all right, I see how you move. We're gonna have to work backwards. I know you want to like get in the weight room, you want to train hard, you want to train high intensity right now, but that's not what you need right now. We're gonna work backwards. We're gonna fix this movement pattern first, and then we're gonna load it and get it high intensity. You're gonna feel better down the road because we're caring more about this now. You might think it's gonna slow your progress down, but it's actually not. It's gonna speed it up eventually.
That's a hard conversation because it's not sexy, right?
Yeah.
The athlete wants to push. They want to see big performance improvements, and it's trying to understand that if you ignore that fourth tire, right,
Yeah.
the ride in the car first becomes a little bumpy, and you can't go as fast, and then all of a sudden you're going to blow it out, and you're going to have an issue.
Mhm.
And it's not sexy. They don't understand the importance of it. They just want to put the hammer down and drive down the road at 120 mile an hour as long as they can. And it's something that we have to do better at in our respective fields. Like we
Mhm.
have to educate these people. And let's be honest, when you and I were in high school, when we were playing ball, they didn't focus on that. This
No.
is the last 20 years. And the hard part, especially in some of these physical sports, is like, well, don't be soft. It's like, hey, I'm all for not being soft, but I'm also for being smart about how we approach keeping that athlete on the field. If they're going to break, let them break on the field in competition or in play. Don't break them in the weight room, or
Yeah.
don't break them at home with their volume that we're programming for them, or whatever, the rehab that I'm handing out. And so I think
Yeah,
it's
I mean, I think that brings up
underappreciated.
I think that brings up the thought of like how I think there's a massive, massive need because there's significantly more injuries within youth athletes, like high school and younger, than there are in actual professionals or college athletes. Um, because like I think there's just a lot less oversight, a lot less care taken for that, like teaching people how to move. It's usually like a high school, like whatever their sport coach or their PE coach who's, giving them some sort of a strength program, or maybe they haven't taken the time to really develop their understanding of movement and everything, and training loads and all that. And so there are some, more wealthy private high schools who are able to employ a strength coach, but the public sector is just like not able to address that. There's not enough funding, but I feel like there's a huge need to um, bring in that sort of professionalism and bring in that opportunity to train these youth athletes from the ground up. If you can teach good movement patterns from a young age, it's going to save people a lot of injuries and stress down the road, you know?
Yeah, I think you're 100% right. I think we're a little bit incomplete on the way we process that thought. We're
Yeah.
missing components of it. For instance, Tommy John surgery, we know it's well documented by ESPN and youth baseball all across the U.S. We got to get them on bands. We got to get them on throwing routines. We got to get them on arm care stuff. Is that important? Absolutely, but it's not solving the issue. The
Mm-hmm.
rate of occurrence of Tommy John issues still going up, and so we're doing all these things that are good, but it's incomplete, and that's a completely different topic, in my opinion, of at least Dr. Keating's opinion of why that's occurring, or why I think that's a complex issue. But yeah, we should probably punt that one a little bit, just so
Yeah.
that we go down a route that we weren't prepared to go down. But I think
Yeah.
that's a valuable topic at some point to cover, is like, why do we see the rate of occurrence in youth athletics with these injuries, right? Why is the rate of injury rather so high in youth athletics? We didn't see this at our parents' age, right? Our dads didn't talk about three guys blowing out their elbows and blowing out their ACLs in football. Why? What's different, right? And we need to spend some time kind of hashing that out and being honest at looking at what we're putting these athletes through, and maybe look at some underlying causes of, why is this grumpy? So
Yeah. And that kind of brings me to the kind of last question I had that we can dive in with the root cause of people's conditions is nutrition. And so this is
yeah,
definitely very much in my zone. I deal with nutrition clients every single day, and it is a foundational lifestyle related thing that strongly affects how people feel, how they recover, how their body's functioning overall. But how do you see nutrition as sort of a root cause for some of the stuff that you see in your practice?
yeah, I think it's underappreciated.
Yeah.
The hard part is, you and I both know that the pie that affects an athlete, right? The diagram, if you will, that affects how that athlete performs, affects the patient's health, affects their recovery, has lots of little slivers in it. And I know, and I've come to know, that I can't service all those needs, right?
Mm,
Am I passionate about every one of them or interested in every one of them? Absolutely. But I'm not the expert on it. And so that's something that has really become something I've appreciated being around docs that work with Team USA, is they know their lane and they run in it. And from a nutrition standpoint, I will consult people on general health stuff, right? We were talking earlier, just, treatment that I do in the office versus the homework for the athlete, right? What does
mm,
the athlete take home? And obviously the manual hands-on part, the rehab, and some of the consultation work on nutrition, I'm going to handle in the office. But then the baton gets passed to the athlete. The baton gets handed to them to go home and address the nutritional concerns, address the rehab that we have them doing, and they need to work at that, and they need to continue to be on top of it. So it's really where nutrition's hard, because it's primarily dependent on the athlete following through with recommendations. It's like, I can't work harder to get that for them, and you can't work harder to get that for them. We just consult and advise and provide education of the why behind what we're giving them. But nutrition, man, in the U.S., we're the wealthiest country in the world, and we are one of the least healthy developed countries, I'll say. And I don't know the ranking, but we're not in the top 10.
yeah.
We're not even close to the top 10. And it's not an issue with healthcare being given to people, which I think is, it's a moral thing to take care of the people around you, right? But beyond that, and without going down that road, our diets suck. They're
Yeah.
awful. They're awful. It's a diet of convenience. We don't view nutrition is something to be prioritized like some of these other countries do, we know how it affects certain disease processes, cardiac issues, diabetes, metabolic, can't talk this morning, metabolic symptoms. Um, we know that. We've known that for 50 years, and yet we're not getting any better at eating healthier. We see obesity rates continue to climb in children. You
Yeah.
know, our parents didn't have fat kids, you know, or overweight kids. And again, you don't want those people feeling bad about themselves, but they have to be educated because they're going to deal with that. And as an athlete, it's like even more so. You have to put the screws to your diet, so that you're investing the nutrients for performance, recovery, and prevention of issues. And man, you do a great job of that. And I hear that from the patients that I see that work with you. You know, it's like, hey, he pointed out X, Y, and Z, and I feel better because of that. So
Yeah, yeah. I mean, as a nutritionist, like that's something that I'm always dealing with. But yeah, like you said that, um, I mean, nutrition is super connected to how you feel, not just like with, I mean, it's important for your recovery. It's important for your inflammation, how your body's dealing with that. Like your diet can make you more inflammatory, as in like you hurt or you feel sluggish. You don't feel like
uh,
you can get up out of bed, or it can be anti-inflammatory. Like it's not going to promote inflammation as much. And that's important because like if you're what you're eating, putting into your body is going to help you have less inflammation, then that's going to essentially help you feel better, feel more energetic. It's going to help you recover better, be more resistant to injury and everything. So
and
it's super important.
it's gonna improve your longevity, man. Like
Yeah.
you're not gonna have these. It's disgusting to me that in our world, in the United States, that the average as we get older is to have three comorbidities. And that term has been thrown around a lot in the last year because of the context that we're living in with the
Hmm.
virus and the pandemic. But even once this resolves with the coronavirus and the implications of that, heart disease, diabetes, the effects of being obese, your increased risk for cancers, that stuff doesn't go away. Like
Yeah.
health is not going to be reduced to have you been vaccinated for COVID? Have you had COVID? Or have you recovered from COVID? Like
Hmm.
most of us are going to be affected with the other stuff that I just mentioned far more likely than we are with the virus. And I think we owe the people that we work with proper consultation on that. You know, my goal is that the patient goes home with tools to live a healthier lifestyle, not only for them, but for their family. And
Hmm.
that they can apply some of these things that will benefit them and benefit their kids when I'm gone. you know, and I think we've got to do a better job at nutritional consultation, and advising on that, not only what to eat, but why. You
Yeah.
know,
Yeah. I
why
think the
should I eat like
challenge,
that?
go ahead.
No, it's like, why do I need to do this? What's the benefit on the back end?
Yeah, I think the challenge is that the reason that people struggle to deal with nutrition is because it's a lifestyle related thing. Like you can hit
Mm-hmm.
the gym for an hour and check it off, but that other 24 hours in the day, that's your nutrition, that's your lifestyle choices, that's everything else. And so nutrition is a lifestyle thing. So like even within my coaching, I'm not just addressing what you eat. It's more, I'm also addressing the emotions, the stress, your schedule, your planning, the way that you're dealing with your life. So it's a nutrition and lifestyle coaching that I, as a nutritionist, end up needing to do to help you actually make progress. And so it's a fascinating thing that, I mean, that's why I think it's such a challenge for people, because it's like, if you compare it to like, oh, I have this huge list of chores I got to get done this weekend. So you end up not doing it at all. You compare that
Yeah,
to like, I just got to take this trash out. I just got to take this bag of trash out to the trash can. Like, oh yeah, I can do that. That's pretty painless. It's really quick. It's going to take
yeah,
less than a minute. That's kind of what it ends up being like. Like I can check off the workout. I'm going to get that done. It makes me feel like I accomplished something because I went and I worked hard. But this nutrition and lifestyle stuff can be a little bit less tangible. It's not as immediate gratification, but it's a foundational thing. Like no amount of workout. It doesn't matter if you have a world-class workout program or coach or anything. It's not going to fix a broken diet or broken lifestyle that's not
No,
supporting
no.
your activity.
Yeah. Yeah. There's a lot of components to that topic,
Yeah.
right? I mean, there's a lot of different things that we could focus on.
Mm-hmm.
The thing that has become more on the forefront of my mind in the last year, and I don't want to take this off topic, but it's just the fact that people know what puts them at risk for certain conditions, but they don't know what to do about it.
Yeah.
And I know that sounds like people are going to hear this and go, well, that's not true. I can Google it. It's like, well, you'll Google it. What should I do to lose weight? And 15 things will come up. Well, which one is good for that athlete, or which one is good for that patient? Is it considering other health issues that they have? And the answer is no. Like, Google doesn't do that. Google will pull up keto's good. Keto's good for some people. Intermittent fasting's good. Paleo's good. Trying to count macros, they're all good for certain subsets of people, but they're not good for everybody. And we've got to be able to tailor that to the individual. And that's why I think working with a nutritionist and talking to the medical doctor and finding a doctor or a sports medicine provider that grasps that beyond a numbers component, right? And by no means is this a negative comment about how we handle like things like resting glucose levels with diabetes, but it's like, if we're not offering advice to these people to prevent that, then we're doing them a disservice. If we see an athlete's numbers going up and we say, you're in the time frame where you can change this if you do X, Y, and Z, then we're doing them a disservice. We owe them better than that.
Yeah. And
So
I think that's why like a big part of like what I'm doing in my coaching and what I think a lot of the health sector can improve at is not just being like, I recognize where you are presently and here's the outcome you want. And then that's where people get stuck and like, I don't know how to get there. And so a big part of what I do is like, all right,
take this road.
Here's the outcome. Let's talk about like what behaviors could help you reach that outcome. And let's choose one and make it incredibly like it sounds like too stupid, like easy to do this behavior. We want to make it that simple and let's try to do that consistently. And then we'll build on that over time until you end up reaching that outcome. And it becomes a permanent thing because you change your behaviors, because it's your behaviors, your lifestyle that ends up leading to that present where you need some help, and you may not even know you need to change your behaviors now, which I think is something we can do better at kind of educating. Like, it's more about prevention. Like, we're in sort of this natural healthcare field of like, I'm in like very much like preventative healthcare as far as a nutritionist and a strength coach. Like, I don't want you to have to get on medication or have surgery or something someday. I want to help you learn the behaviors and the things you can do day in and day out to help you prevent that down the road.
Yeah. It makes getting up every day worth it.
Oh yeah. Fascinating stuff.
Exciting. And I think there's a real opportunity with just how hyper focused we've become on the elements of health over the last year. Even things like washing your hands, but we have people's ear probably now more than ever with how can I avoid bad outcomes health-wise? Let's be real. Something's going to get us all. But there's things that there's steps that we can take. And like you said, directions that we can go on the map to get to certain goals that eliminates or reduces risk of certain things getting us. And that's all we do. And we got to kind of fight the good fight as long as we can fight it.
Yeah.